Okay, we're going to talk about the eyes. And for me, if a child has a really big ocular deficit, and I've worked through their primitive reflexes, their core, their balance, and it's not improving dramatically, I'm going to refer them for vision therapy. I mean, that's what vision therapy's for. That's their job. If it's something simple and so far their eyes have improved a ton, and it's maybe just an integration issue that they just need a little extra stimulus, then that's something that maybe I'll work on, right? So I want to start there and say, if it's a really big deficit, refer them to an eye doctor that does vision therapy. And I think it's an FOVD is what you want to look for at the end of their initials. So it's Fellow of Optometry and Visual Development, FOVD. Those guys do a lot of visual rehabilitation, visual therapy, and they're awesome. So that's kind of the key that I look for when I'm looking for an eye doctor to work with. And also, that's a great, if they have an FOVD behind their initials, that is a fantastic referral network for you. That is how I started my practice. I went and talked to a doctor that works with visual development and said, hey, I work on primitive reflexes and I work on integrating these. I can do it really quickly, within a couple weeks to maybe a couple months tops. And they go, well, it takes me 8 to 10 months to get rid of these reflexes. I'm going to refer them to you first, and then you're going to send them back to visual therapy. I said, great. I had 30 new patients that week from one referral source. That's actually what got my practice started, was an eye doctor. Prior to meeting her, I maybe saw like 10% pediatrics. After meeting her, within 6 months, I was over 90% pediatrics. So an eye doctor that works on visual development can be one of your best friends. And the eye doctor in my town is probably one of my, I shouldn't say isn't my best friend, but we have a very, very, very good working relationship. I send patients to her almost every day. She sends patients to me almost every day. So it's a great referral network there. And making sure that they understand that you're not doing visual therapy, like you're not doing vision rehab, like you're going to send them to them when they need that. And they know that. And if that doctor is really there to help the child, they're happily going to send them to you. And if you're there to help the child, you're happily going to send them back to them. And it becomes a really good working relationship there. So I can't stress that enough. It's really helpful. But from a vision standpoint, I don't focus a lot on that, to be honest. I want to see what changes visually, because to me, the eyes are really a window into the brain. And when a child has a pursuit deficit, like they can't pursue something appropriately, I know their cerebellum's involved and I know their parietal lobe's involved. So if I start stimulating that and I get better health in that area, that's a finding that should change. Their pursuits should get smoother, which usually it does. If they can't saccade, I know that if they can't initiate the movement quickly enough, I know it's from their frontal lobes. And also if they can't stop accurately, I know it's from their cerebellum. So if that is a deficit and it gets better, well, I know that we made improvements to the brain. Fixations, if they can't keep their eyes stable, usually it's because they don't have good balance. So if their fixations get better, I know their vestibular system is getting more integrated. So, and I want to make sure they can converge their eyes in. They can see one at all times. And the reason why I taught you how to check this stuff is not necessarily that you have to be the one that rehabs it. You can give them exercises to do that. You can work on, maybe some convergence activities while they're balancing. You can work on saccades while they're balancing. You can work on pursuits while they're balancing, and work on all that ocular integration stuff with their balance centers. But if these are really big deficits, to be honest, I would send them to someone that does vision therapy after you've gotten rid of their primitive reflexes, after you got their muscle tone normalized, after you've gotten their vestibular system developed. Because there's a lot of kids that come to me that have done vision therapy for 2 years and have made very little of any improvement. And then you get rid of those things and their eyes dramatically improve. Then I send them back to vision therapy. Then everything normalizes. They can now retrain their eyes because there's no roadblocks in the way. I truly feel that my job is that early development. I'm happy to send them to someone to do vision therapy, to retrain all that stuff if needed. But I want you to look at them. I want you to, do some activities in the office for them while you're working on their vestibular system, and then retest it and see if it normalizes. Because if it does, now they don't need vision therapy because their eyes are normal. But always make sure, like, I'll send them to a vision doctor before I work with them if they have really big deficits, right? Because I want someone else monitoring that and watching that, because the eyes are so important. I want someone that's their whole job is just to look at that. But then I want to work with them for a while. I want to see, does it change? And then send them back to the eye doctor. Does it change from their perspective? Because usually it does. Then now the parent has, not only are you saying it's improving, they come back and they go, oh my gosh, we went to our eye doctor. They are just amazed at how well their eyes are doing, how much they've improved. They do want to start doing some vision therapy, but man, they're just blown away by how much they've improved. Awesome. Let's have them do vision therapy. And then you send them out. You say, hey, let's go get vision therapy done. Let's make it happen. And now you're working as a team with another provider. That parent, that kid is so much better. The parent is ecstatic because their eyes have improved and you've never even done anything for their eyes. And now you've also sent them to someone that you trust that's going to do great visual rehab. And they're ecstatic about the results they got there, which guess what they're going to do? They're going to send more people to you because they know that you're a good team player. You're sending patients their way, but also they know you do good work and you're going to help that child get better before they ever do vision therapy. And you're going to make their job way easier. Because I have 2 vision therapists that work for me that also work in vision therapy. And they tell me all the time, it's so hard to work with this child that I know has primitive reflexes and we're trying to integrate them, but we don't have the same tools. Or I know they have a gluten sensitivity, but they can't talk about that stuff. Or I know that they have a vestibular issue that they just don't have the systems in place to deal with because they're only trained to deal with the eyes. So it's really helpful from their vision therapy standpoint as well. So I'm going to give you some exercises to do, but I always want you to think of doing this with vestibular integration as much as possible. Like while they're balancing, while they're moving, all of that stuff, make sure we're integrating it with the vestibular system most importantly. And how I work through this is, from a developmental perspective, I work through, they need to be able to fixate first. So a lot of times I'll just have them do just straight fixations with body rotations or head rotations. So I'm going to show you some examples of. From there, we need to be able to saccade. So we do fixation, saccade, fixation. That's the next movement because that's how it matures. Then a pursuit is saccade fixation, saccade fixation, saccade fixation. That happens so fast that it looks smooth. So then we start working on pursuits. And that's the order. That's the normal developmental order. And that's really what I work through on kids. So I'm going to show you videos on all that. Thanks for taking the time to check out this video. To learn more or to schedule an intensive or anything with my team, there's a link below. Just go ahead and click that and that'll get you to the right spot. Have an awesome day.